So I've been having constipation issues for a while now, and also back pain. The back pain's been on and off for about, I want to say, 5 to 6 years now.
Wow.
And also the constipation, it's so severe that I can't go to the bathroom from 3 to 5 days, depending on how my diet is that week. And upper back pain has been bothering me for a couple months.
All
So
right.
it's been affecting my lifestyle.
I understand you're experiencing constipation and you're only going once every 3 to 5 days. Right? So that already tells me I want to take a closer look what's going on in this region over here. In addition to, you've been experiencing sciatica and low back pain all straight down and ends right over here. Okay, so here's the deal. Okay, our nerve system. Okay, primary responsibility is not just moving the legs around or feeling pain or what have you. Primary purpose is to get all these organs functioning as well as they should. Okay, now in your case, since there's some kind of obstruction going on over here, is not allowing these organs over here, okay, to function properly. So in your case, everything's been backed up in your large intestines and your sigmoid colon. Okay, just like a conveyor belt system, you got to get these fellows running. But since you don't have proper nerve function to these fellows over here, the colons and everything else is, oh guys, okay, let's start slowing things down. Okay, in addition to primary function of the colon and the large intestines, what do? They absorb the water. Okay, so it's doing its job. It'll keep on absorbing the water. So that's why you experience the constipation, the hard stool, and have a lot of difficulty passing the stool, right? So it's only doing its job. Only thing that's missing is trying to push the poop outwards, right? It's not getting that proper command, all because of here. So we're going to restore this nerve function over here and get this fellow moving again. In addition to, okay, can help you with this problem over here as well. Okay, we had so in this X-ray we identified actually 4 structural abnormalities. Right over here, the 5th lumbar, okay, and then 6th dorsal, 2nd dorsal, and occiput itself. Now, right now we're going to triage it. Okay, right now the most urgent thing in you is we have to correct this 5th lumbar over here. So in your case, okay, the 5th lumbar went backwards as such, okay, and also tilted a little bit inferiorwards as such as well. So from a normal position, as you can see in this foramen shape over here, this is a spinal nerve. They're actually this big. You don't need a microscope. This is actual dimension size.
Oh.
Okay? Yeah, they're pretty huge.
Yeah.
Okay? Why? Because, again, you got to let all those organs function, right? So, as you see over here, in this normal position, they're fine. However, due to trauma, okay, see how much that foramen starts shrinking down, that tunnel, okay, that space starts shrinking down. And a little inferiority, guess what happens to it? Shrinks even more. Now, I just want to be very clear, okay? Bones do not pinch that nerve, okay? 99% of the time, it doesn't, okay? Now, just like when you sprain an ankle, what happens? It swells up, right? Same deal as what happens over here. So when we have a structure that shifts out of alignment like such, okay, what happens is it becomes inflamed, and all that tissue starts swelling up like an airbag to try to stabilize this, okay? To clarify what I mean by is, like here, normal, see this? Normal movement. However, trauma, like out of alignment, see how unstable that is? So again, all that edema, swelling, acts like an airbag to try to protect this joint. However, trade-off, start pinching that nerve. Okay. In addition to, and I wouldn't be surprised, because it's this unstable, your surrounding postural muscles start clenching up, try to stabilize even more. So that's why it helps explain why you feel all that muscle spasms from time to time in your low back, right? Now, going back to things to explain. Like I said, 99% of the time, the bones don't pinch that nerve. There's only one rare 1%. And that's when it gets this bad. When the bones degenerate so much, and the disc degenerates so much, it becomes this poor fellow over here, and the bones do pinch that nerve over there. No choice, because there's just nothing left in that disc, right? But you don't have that case. What I do see over here is, that disc, yeah, it's not happy. So we don't have full size, but according to that X-ray over there, what I am seeing is you lost quite a bit. Okay, you easily lost 1/3 to a half right over here, especially this back part over here. Okay, so we got to reposition that fella back to where it got to be. Okay, so that's what we're going to go with. In addition to, okay, what I also notice is this. This is what normal is supposed to look like. I don't see any bowel gas here whatsoever. That's normal. Good. What do we see over here?
A lot of gas.
Exactly, a lot of gas. Keep on going all the way straight through. We're following the whole entire large intestines, including the sigmoid colon. On the lateral, we see the same thing as well. It's all spotted gases over here, okay? So that tells us, yeah, constipation and that fifth lumbar nerve is not functioning as well as it should. So we're gonna reposition that, get that pressure off that nerve over there, and let that nerve start regenerating and rebuilding and recommunicating with the large intestines, get it working again, okay? So just want to let you know, you probably don't want to go too far away from a toilet after we adjust you. Typically, most patients with this kind of problem, within about between 2 to 4 hours later on, you may need to go to the toilet. Okay, it's that quick.
Okay.
All right. Okay, as we can see over here, there's quite a bit of swelling in this region over here. It's all pooling. Let's check it right here. Finger right there?
Oh, yep.
Yeah, okay. So we already found the spot right there. Let's check your foundation. Foundation's fine. It's just that fifth lumbar. Okay. Feel that difference right there?
Yeah.
Tough time moving to the right. Not too bad moving to the left. Feel that difference right there?
Mm-hmm.
Okay, so that fifth lumbar, that's what we're going to correct on you. Nice shoulder right away. Come on, please. There it is, right there.
Yeah.
Just relax, a little more, right there.
Oh.
Come on up. Okay, walk around.
Wait, there's no pain. There's no pain.
Oh, happy about that, huh?
Thank you. Thank you. Actually, I don't feel any pain anymore. That's weird. That's crazy.
Super fast, yeah?
Yeah.
Keep walking around.
What the heck? There really is none. Nothing. That's awesome.
Okay, like I said, okay, don't go away too far, okay?
Okay.
I wouldn't be surprised. Your bowel movements start moving pretty darn quick.
Okay.
All right?
Alright, sounds good.
Anything else?
Nope, that's it. Thank you,
Okay.
doctor.
Have a seat.
Okay.
Let's take a look, see what we got for our scope reading. Okay. Okay, need you to walk a little more.
Okay. Walk this way?
Just need you to walk a little bit. You still have some nerve pressure there, that's why.
Gotcha. But it's not as painful as before. That's good.
See, that's what happens when we do a very precise precision correction to your structure of your spine itself. So when we realign it properly to where it gotta be, taking that pressure off the nerve, that's why symptomatic, response can be very quick. Okay, but I'm more concerned about is how's your nerve functioning right now. Okay, so that's why I need you to walk around a little more.
Okay.
Because we need to pump up that disc, okay, and get some more of that swelling out of the way.
Okay.
So we can retest your nerve and see how that's responding.
Okay. Sounds good.
Have a seat. Okay. You still have pressure on the nerve over there. Okay? It's significantly reduced, but it's still present. Okay, so here's your homework, and this is what I want you to do. I want you to ice this area 20 minutes, 3 times a day with ice pack.
Okay.
Right?
My back's gotten a little better. There's not much as pain going down my leg anymore, but the constipation is a little better. Not as quick as I thought it would be, but I am going to the bathroom more often than before.
Okay, so if I recall, you were going like once every 3 to 5 days.
Yeah.
Right. And what is it now?
Now it's about once every 2 to 3 days instead of 3 to 5.
All right, you got it. So we still got work to do.
Yeah. So I work long hours. Lower back's not having any pain anymore.
Good.
But my main concern was my digestion, and I've been able to go to the bathroom maybe 1 or 2 times every day or 2 days.
Yeah, that's very good.
Yeah, compared to before, definitely.